again. Go ahead.
Health. What is health? Health is more than being physically well. It's having a secure place to call home. It's having access to mental health resources. It's having a safe neighborhood to play in and a stable job to help pay the bills. Health is where you live, learn, work, and play. For over 100 years, Michael Reese Hospital held its doors open to Chicagoans, offering innovative and exceptional care, and a commitment to welcome everyone, regardless of who you were, what you believed, where you came from, or whether you could afford to pay for care. When the hospital closed its doors, we at the Michael Reese Health Trust opened ours. By carrying on the hospital's founding value to repair the world, we advance equitable access to health solutions and opportunities for all. Our work is to improve the health of all Chicagoans. That means ensuring that no matter what neighborhood you live in, access to a healthy life is within reach. Through our incubation, grant-making, and advocacy programs, we partner with organizations across the city to ensure the best, most impactful ideas are given the support they need to better Chicago. This is our home. These are our neighborhoods. And we are all connected to one another. We believe the future of our city is a healthier one for all. We are Michael Reese.
Thank you, Gayla, and really appreciate seeing the video, which I think really captured so well what Michael Reese does. My dad would be so honored to have this award named in his memory and for the inaugural honor to go to so respected and accomplished an individual as Dr. Goodman. My dad was my North Star. He was an incredibly kind and generous human being. He was a leader whose passion, commitment, and vision led others to want to follow him, to be in his orbit. He was keenly focused on results and kept his eye on the outcome he was trying to achieve. When there was dissent or people who seemed to be working at cross purposes, he always looked for ways to bring people together for the greater good. And he genuinely believed in the importance of giving back to community, something he ingrained deeply in each of his children. My dad was a very accomplished businessman, but it was his lifelong dedication to community service that was his enduring legacy. He served Michael Reese continuously from the early 1960s until the day he died in April 2020, starting with the hospital's Medical Research Institute Council Board, which he chaired. And he went on to serve on the hospital's board and then the board of the Michael Reese Health Trust, including 8 years as its chairman. You might say Michael Reese was in my dad's blood. His great uncle was responsible for establishing the first children's hospital in Chicago in 1913. The Sarah Morris Children's Hospital at Michael Reese, and led its Department of Pediatrics. My dad's father served on the Reese board from 1936 to 1954. Being committed to one organization for 6 decades says a lot about who my dad was, about his incredible dedication to service, to helping others less privileged than he was, to community. He took personal responsibility to make the world around him a better place. And it is this responsibility each of us have to care for each other, to care for our community. Drawing on the collective experiences of my dad and my own 40-year career in healthcare, I gained a critical insight. Health is, in fact, everything. Fast forward to today, where we are now more than 18 months into the COVID-19 pandemic, health is indeed everything. And disparities are playing out on the world stage with devastating consequences. And if we've learned nothing else, we live in an interconnected world where our individual health is intertwined with our local, national, and global community's health. Said another way, if we do our part, the ripple effect can be huge. Actions we take can and do affect other people. It all comes down to the power of community coming together to solve big problems. That brings me back to this award, which was established to recognize someone who exemplifies my dad's philanthropic character, generosity toward others, intelligent approach to problem solving, and lifetime desire to make the world a healthier, more humane place. There is no one more deserving than Dr. Larry Goodman to be named the inaugural recipient of this award. Dr. Goodman, whose own ripple effect out in the community continues to have a huge and enduring impact on health and equity. President Emeritus of Rush University and the retired CEO of Rush University Medical Center and the Rush University System for Health, Dr. Goodman's influence has been immense, but he approaches his work with a humility and compassion, leading from behind, not top down. He listened to the community, the very people he was trying to help, and brought their ideas forward. And he is a unifier. In this way, he impacted the lives of so many people, both at Rush and in the community. Over the course of his 17-year tenure at Rush, the hospital more than doubled in size, gained national recognition with a steady stream of honors for Rush, and pioneered a winning approach to community engagement. In fact, Dr. Goodman was so strong a leader that when he left the organization, his role was divided among two leaders. Today, we recognize Dr. Goodman not just for his extraordinary vision, but also for the enduring impact he achieved by knowing how to bring that vision to life through others. Not only did Rush thrive under his leadership, but he spearheaded a whole new approach to partnerships and community engagement to better address health inequities on the west side of Chicago, an approach quite aligned with the mission and values of the Michael Reese Health Trust. Among his legacies was the creation of Westside United, a coalition of health systems, public institutions, residents, and community groups formed in 2017. The group aims to address some of the root causes that have led to a nearly 2 decades long discrepancy in life expectancy for some Westside residents compared with those in Chicago's affluent neighborhoods. People living in the diverse neighborhoods of Chicago's West Side experience rates of chronic diseases like diabetes, asthma, hypertension, and infant mortality far above the national average. He understood that illnesses that shorten people's lives are more the product of their environment than their biology. Dr. Goodman's exceptional vision, creativity, and commitment that made possible this unique partnership also set it up to have a sustained and lasting impact. We considered some incredibly accomplished individuals for this award, but Dr. Goodman was the unanimous choice to receive the inaugural John F. Benjamin Service Award. I couldn't be prouder to have my dad's memory associated with someone of such great integrity, character, generosity of spirit, intelligence, and accomplishment. Someone as determined as my dad to leave the world a better place than he found it. Please join me in congratulating Dr. Goodman.
Wow, Sally, that was incredible. I am so incredibly honored to be recognized for an award like this that honors an individual like John Benjamin, representing an organization like the Michael Reese Health Trust, and presented by a person like Sally Benjamin Young. Thank you. I do know what it means to say a place gets in your blood. Rush got in my blood. I started at Rush as an intern, and like your dad, became a lifer, spending over 40 years there. I think a place gets in your blood when both its mission and its culture resonate with yours. But great institutions don't just rise up de novo. They require leadership and stewardship, and your dad's commitment and board leadership were so critical in making Michael Reese what it was in the past and what it is today. Similarly, sincere thanks to the people on this call who serve on boards or otherwise support not-for-profits that are trying to make a difference. I know Rush would be nothing like it is today without our dedicated board members, and I can't thank them enough. I'm incredibly honored to receive this award, but can do so only as a representative of Rush. It's really the board, the leadership team, the faculty, the staff, and students of Rush that are the ones that are deserving. I'm only receiving this on their behalf. When I completed medical school, we all took the Hippocratic Oath, which admonishes doctors to first do no harm. While that may sound like a low bar, it turns out that isn't so easy, since many of our tests and treatments carry real risks. In more modern times, it might be more reasonable to say that the risk-benefit ratio should always strongly favor the patient. I remember hoping as an intern that I might have a chance to save someone before I did something that harmed someone. Later, I used to think that a positive intent, coupled with high-quality care, was satisfying any similar ethical responsibility, that hospitals and medical centers might have? Aren't we doing okay if we provide the same great treatment to everyone that comes to us, regardless of their ability to pay? I now believe the answer to that question is no. When the environment is rife with inequity, then I believe we have a duty to take all reasonable steps to correct these inequities. When people who live 4 L stops west of Rush live about 14 years less than those that live on the Gold Coast, something's wrong. We now know that the something is the so-called social determinants of health: crowded living conditions, food insecurity, homelessness, and other effects of poverty. These problems lead to very real and very negative health outcomes, and they disproportionately impact people of color. Not surprisingly, about a year and a half ago, 38 or 9 of the cities and regions, health centers, hospitals, and clinics all co-signed a letter to the editor stating that racism is a public health problem. This produces differences in health outcomes and quality of life. And these are not just differences, they are inequities. A difference is just an observation. An inequity is an unfair difference. And there's something inherently unfair about how we got here as a community. First, do no harm. Well, what if the harm has already been done? And what if by our inaction, additional harm is done unless some corrective steps are taken? I think that's where we find ourselves today, and the pandemic made this even clearer. But the good news is it doesn't have to be this way. These are big problems, but they can be solved when people work together, have clear goals and metrics, and hold themselves accountable for progress. There are many effective strategies, and they all start with getting the input of the affected communities themselves. Many great people at Rush taught me and demonstrated that change is possible through partnerships and investments, and these initiatives can also be good business. The Michael Reese Health Foundation has supported so many of these same efforts. The gifts of medical research get more incredible every year, but they should be equally available to everyone, as should educational opportunities, access to safe living conditions, and economic opportunities. Sally, your father, John, did his best to correct inequities like these through decades of service. It's my great honor to receive this inaugural award celebrating his life and legacy. Thank you so much. And those of you who are viewing, this is the award, which is a very large statuette in his name and in his likeness. Again, thank you.
Thank you, Sally, and thank you, Dr. Goodman, for your generosity in accepting this award, and certainly for your lifelong commitment to Tikkun Olam, repairing the world. And now let's begin our panel discussion, Advancing Health Equity, Celebrating Our Community. So following the theme that health is where you live, learn, work, and play, I'm going to now introduce our panelists who represent organizations with whom Michael Reese partners to create a healthier Chicago. First up, we have Christine Haley. She's the Director of Housing for Cook County Health, one of the nation's largest public health and hospital systems. And even before the COVID crisis, Christine understood what those experiencing homelessness needed to achieve health and has dedicated her life to connecting Cook County's residents to affordable housing, permanent supportive housing, medical respite, and homeless prevention resources. Today, she's going to tell you about the Cook County Health and Housing Forward 19-bed Medical Respite Center in Oak Park. Next up is Xavier Nogueras, president of Boca Media Group and co-founder of Illinois Unidos, one of Illinois' leading political communication strategists. Xavier was born in Pilsen and raised in Chicago's Humboldt Park neighborhood, and he became a community organizer early in life. When COVID-19 started to surface in large numbers, Xavier recognized early how a diverse set of Latino stakeholders could convene and collaborate to address the alarming coronavirus rate in the Latino community. Today, Illinois Unidos is a consortium of over 100 health professionals, community-based organizations, elected and appointed officials, and interested professionals. Together with his community, they work to stop the spread of COVID-19 in their neighborhoods, while also addressing related public health issues and the devastating economic impact of COVID-19. And last but not least, Jacqueline Ingram grew up in North Lawndale, and she currently resides there. Jacqueline serves as a board member for the Institute for Community Empowerment, or ICE, which for over 30 years has taught residents of Chicago the skills of community organizing to ensure they participate fully to address the issues that matter most in their communities and in their lives. ICE has been working with the Chicago Coalition to save our mental health centers, to develop a new model for delivering community mental health services tailored specifically to local community needs. Jacqueline will share her journey of how she and other community members from North Lawndale, East and West Garfield Park, near West Side, they came together to create the expanded mental health services program through community organizing to develop community health centers in 5 Chicago neighborhoods. The model is simple, it's effective, and engages the community in owning their own health. Talk about teaching a community to fish. Way to go. So thank you to each of our panelists for being with us today. And now I shall turn the program over to Dr. Goodman, Christine Haley, Xavier Nogueras, and Jacqueline Ingram to discuss how their work is impacting health equity. Take it away.
Well, thanks, Gayla. And we did meet earlier this week and thought about how to best present some of the issues that this wonderful panel represents. We thought rather than overwhelm all of you with the inequities, we talk a little bit more about some of the successes. And Christine, let me start with you. As the Director of Housing for Cook County Health, can you talk a little bit about some things that have occurred over the last few years, let's say, that really have been marks of success in your area?
So we have really been focused on understanding how we close the mortality disparity that exists for people experiencing homelessness. So we understand from both national data that the average age of death of a woman experiencing homelessness is 48 years old, and a man is 51 years old. So as we heard earlier today about disparity, we are really looking to understand how do we make investments in housing to close that gap. We also understand that there's much that can be done at the individual level and at the policy level to be able to make to address those closures and mortality. And so Michael Reese Health Trust did help support a number of years ago the creation of the Chicago and Cook County Strategic Plan for Housing and Health, also known as H2. And with H2 established a platform for us to, both as policy members, service providers and others, to understand how we bring health systems and housing systems together around closing the mortality gap and ending homelessness. So we at Cook County Health have invested in a number of interventions around housing and health, most notably the Chicago and Cook County Flexible Housing Pool, where to date 350 households have been housed through a partnership with the City of Chicago, our health plan, County Care, the Center for Housing and Health, and a number of community-based housing providers. But when the pandemic started, it really helped highlight and see when there were stay-at-home orders that for people experiencing homelessness, that there was no home for people to stay safe in. And it really helped highlight, I think, for our community and communities across the country, that without a stable, safe, and secure place to live, that you weren't able to protect yourself from COVID. And how could we allow this to happen and really make a concerted effort around protecting and ensuring that folks had, that everyone has a place to live. So in that, we mobilized together with a number of housing organizations and health organizations and city and county government and starting a group called Charge, the Chicago Homeless and Health Group Response for Equity, that Rush was also the lead facilitator of. And in that, we partnered with the city to open a COVID isolation center for people experiencing homelessness. So we had a center on the south side. We wanted to be on the south side. We have 2 hospitals. Provident is our south side hospital, and really wanted, and and joined together to create this COVID Isolation Center South. From that, we leveraged our own resources to be able to partner with the city in opening up that center. And it's led us now to partner with Housing Forward in the western suburbs to operate a 19-bed medical respite center, where we are serving people right now we do some COVID isolation, but we're also supporting people as they're exiting hospitals and need a place to recover. So either from a surgery, who may have cancer and need protective isolation, and doing a lot of wound care. So over the winter, we took care of a lot of people who had frostbite and had amputations due to frostbite. So I think that we see the need for long-term housing and to prevent amputations, to prevent people from being contracting COVID, and understand that the long-term bringing together stable, affordable, and safe housing is the path needed for the future.
That's tremendous, with a really great example of partnerships, philanthropic support, government support. It's really great. Xavier, with Illinois Unidos and other efforts you've been involved in, what are some of the successes you could talk about recently?
Well, we formed back in March around the lockdown, when several professionals, ironically, not health professionals, but just folks and stakeholders in the community saw that there wasn't a space to talk about our narrative in the Latino community. We felt some of the strategies that were being implemented weren't culturally relevant to our community. And so we got together, just doctors from the neighborhood, nurses, elected officials, business professionals, and we got together on a Zoom call. I remember the meeting like it was yesterday. We were supposed to have about 15 folks, 20 folks, about 50 folks showed up, and we decided to formalize it to where we're at now. We're about 150 stakeholders. And why that's important is because we were able to use the partnership to leverage power, right? That's how we were able to tell our narrative. That's how we were able to sit with the city, sit with the county, bring our strategies. And frankly, if we didn't get together and form that power as a coalition, many of our strategies maybe would have gotten unheard. Many of our stories maybe would not have been told. And so here we are now. We've been able to shape policy. We actually recently helped write an ordinance with Cook County Commissioner Alma Naya, the anti-retaliation ordinance, where folks would not get a retaliation for talking about the conditions. We've been able to produce 2 TV shows that showed on Telemundo, raise $1.5 million and give mini grants to organizations that probably would not qualify because they're really small, and some of the local neighborhood organizations. And the bottom line is that by getting together and leveraging that power, we were able to do these things and leverage our own strategies. And now the institution, now the partnership is looking at forming itself into an institution that addresses health inequities. So that's how much it's grown in a year and a half.
Mm-hmm.
It's phenomenal. And often the word power is, kind of a mixed feeling term. I think of it now as something, the power to be able to suggest ideas and strategies that are far more likely to work because they come from the community. We saw that in Westside United, as people didn't want someone to come in and tell them what will help. They want a chance to be able to voice those strategies, develop them, and be part of them. So I think it's phenomenal. Jacqueline, let me ask you the same question about successes. And here in an area where mental health is now being recognized increasingly as something that's impacting all ages in all settings, really even worse at times of COVID, and a time when resources are very short, in short supply. So have there been successes in your area, and can you talk to us about them?
Yes, I can, Dr. Goodman, and thank you so much. So the success for us, I would say the Coalition to Save Our Mental Health Centers success for the West Side was when we were introduced to the campaign in the late part of 2015. Now, the North River campaign in 2011 created a statewide law called the Community Expanded Mental Health Services Act. That law grants any community the right to place a referendum on the ballot that allows voters to decide if they want a mental health a mental health center in their community, and willingly increase their property taxes to pay for it. So for every $1,000 a person pays in property tax, it would be $4 per year, and that would fund the center. Now for us on the West Side, that was a huge success because so many health centers had been closed, and we were asking for so much help from politicians, and we're not getting anything from anyone. The law released an outcry from the West Side communities, and we wanted to find out how could we duplicate their process to get a mental health center in our neighborhood. And the best way to answer that is to say that the voices of the people were the ones that wanted to do the work, the voices of the community, the voices of the people that were in need. So our campaign began in 2016, and by October 15th of 2019, which is coming up our 2-year anniversary, I would say that we have opened, and we were the second mental health facility called the Encompassing Center. It's a fully community operated mental health facility, and it is a facility that is run by the people and operated by the people. And it was really amazing because even though that we had started this, other communities had heard what we were doing. And I can honestly say that when you think about COVID, and that's what we all talked about, that has been our biggest drawback. I would have to say that in Bronzeville, they successfully got 7,200 signatures in a COVID pandemic to get their community aroused and say, hey, we too want a mental health facility. So our successes have been based basically on the hard work of the community and the needs of the community. It's really something when you want something and you wait for people to give it to you, and then you wait and it never comes. But this is a proven organization that can give us a blueprint of how we can get our mental health centers in our community. So I would say that would be our biggest success.
That's tremendous.
Mhm.
I think that often as people read about what's going on in healthcare and inequities, it can be overwhelming, which is one of the reasons we wanted to start this panel with some success stories. I think the other thing is it can feel kind of hopeless and people can be so overwhelmed. Now, here are 3 people who are tremendous individuals working at the ground level. They don't see merely the organizational issues. You're with individuals that are impacted by inequities every day. So I thought it'd be useful for people who are listening to this and watching it to get a sense from you whether you're hopeful or not. So Christine, let's start with you.
I think we are in a point in our fight to end homelessness that is incredibly exciting. I think, homelessness is a piece that is hidden in plain sight. It's something that at least, on my way to work, I see a number of people experiencing homelessness. There are huge racial disparities. We see that for individuals, nearly 80% of people experiencing homelessness are Black. And if you think about children who are living in shelters, or who are living in cars, 90% of children experiencing homelessness are African American. So I think that as we've come upon a type of work in our country around looking at racial disparities and seeing how racial disparities are right in front of us, thinking about homelessness within a racial equity frame is one that I think is important for us to push forward. Second, we have an incredible opportunity as homelessness is much more, was something that our government leaders and our community leaders are pushing forward because of the pandemic. There are new resources to end homelessness that have never existed. So we see with the city of Chicago in the Lightfoot's budget included over $200 million to go towards housing and services to prevent homelessness. And Governor Pritzker just recently announced an executive order around ending homelessness. And in that executive order includes the creation of an interagency council on homelessness and a community advisory board. So at a state level, there will be coordination around homeless resources and with community input and providers around creating a state plan, which we've never had. So I'm incredibly hopeful around what we see. We see reductions in the number of families experiencing homelessness, and in some days that some of the we hear from some of our family shelters that their census has gone down, which could be and so we're trying to understand, is that also part of the investments in the child tax credit and other micro grants and other ways in which there's been creative investment in supporting families. So I think we have a lot before us in the next few years, especially as we see more development of housing really targeted to supporting people experiencing homelessness and having that health focus on their needs. I think with our work in the flexible housing pool, it's been very important for us to incorporate care management with our health plan so that we are helping people once they have housing, you're able to focus on other health needs. Without housing, it's difficult to do so. So we're really hopeful that not only will there be additional housing being built that we will see in the years ahead, but that we will see improvement in health outcomes and ultimately reduce that mortality gap.
That's great. Thank you. And Xavier, I want to make sure we stay on time. So in about 2 minutes, can you summarize your thoughts on whether you're hopeful or kind of bummed out about what's going on?
Well, started bummed out. And I mean, this was tough. Listen, COVID-19 exposed a lot of things, right? We knew it was bad, but COVID-19 exposed even more health inequities and exposed a whole bunch of stuff that was going on that we knew, but now it was out front, especially when we talk about the inequities in communities of color. That being said, I am hopeful because regular folks like, I'm not in the health field, I'm a communication specialist, but I became a health advocate, and I saw a lot of folks in the community who were not health professionals overnight become health advocates fighting for their communities. And then on the other side, I saw doctors and nurses become organizers, the opposite, right? They became organizers. And I know, like, we have a Dr. Marina Del Rios, who was the first person, by the way, who got vaccinated in the state of Illinois. And she's sort of our spokesperson. And, overnight, like, she just became this organizer and a voice all over the country for our community. So, that gave me a lot of hope. But there's no doubt that the community has to keep on organizing and not let its guard down. Because if we let our guard down, then there won't be hope. If we do not tell our story, if we do not give our strategies, we had doctors giving strategies to Cook County, at the state level, at the city level, and these doctors were from our community. And I think we learned that the state, the city, Illinois, they've done a great job, and they're well-intentioned, but they don't know it all. They don't. And so from the beginning, I think what we've learned is that don't wait. From the beginning, community has to be at the table. And if you do that, then things will be better. Let's not wait. We learn. If we didn't learn this time, then we're not going to learn. Community should be at the table from the beginning. And again, that's what seeing these doctors and nurses become organizers and organizing folks. It's just amazing, and they just deserve a lot of kudos. And that really gives me a lot of hope for the future.
Thank you. And Chaplain, how about you?
And you know what, Dr. Goodman, I'm going to be really short. So I'm going to say that we are always hopeful. And Christina and Xavier has really said everything that we all believe in. You have to have hope. I could just say the best way to answer that question is, in a helpless community in dire straits, It's always hopeful because you have nothing to lose. We know what it looked like before, and we know what we can do for a better future. It allows every person a voice in changing the future of their community. So we have to stay hopeful.
Thank you. And as I hand this over to Gayla, let me just add my both thanks to each of you as panelists and also my own sense of hopefulness. What I've seen, actually what I've never seen until the last few years, is the sense of partnership in the Chicagoland community. I've also seen where funding organizations like the Michael Reese Health Trust have been selective and demanding, appropriately demanding, on what it funds, how it expects people to work together, and outcome measurements. I think there's a public knowledge and acceptance, and when I say acceptance, at least knowledge of the inequities that exist, and appropriately being horrified by these inequities and wanting something done. What I've seen myself is that another example I would give is what's going on with breast cancer in the Chicagoland community. Large Black-white discrepancy in mortality, with Black women dying at much higher rates than white women, and worse than almost any other city in the country. And then came the Metropolitan Chicago Breast Cancer Task Force, which is now an organization called Equal Hope, which actually ended up creating large partnerships, looking at access to mammography and a variety of other things, that now Chicago is the most improved city in the Black-white discrepancy. There's still a discrepancy, but it's the most improved city in the United States. These partnerships and these common ways to measure outcomes can work. And it's really due to leadership like the three of you and the phenomenal support like the Michael Reese Health Trust. So thank you. And Gayla, let me hand this back to you.
Thank you all so much. This was such a good conversation, and I appreciated your thoughts. I appreciated you sharing what you've each learned in this journey, the power of the community, the power of the people, and the importance of you sitting at the table. And thank you, Dr. Goodman, for your wonderful moderation. Also, thanks to all of the panelists and to Sally Benjamin Young. And let me thank each of you who attended this today. Our audience is made up of grantee partners, philanthropic partners, members of the public and private sector, and certainly a large group supporting Dr. Goodman from Rush University. As a public foundation, Michael Reese must raise funds. We can incubate new initiatives, we can help scale promising practices, and we can advocate for systemic change. We made the decision to become public because we believe foundations can do more with their resources, so that those of you who are providing services or implementing proven strategies to achieve health equity, so that you can do what you do best. This work we learned about today exemplifies what it means to doggedly pursue health equity. Your support, whether it's through partnership, through funding, or collaborating in other ways, is helping us broaden and deepen our impact in Chicago. You each will get an email following this in the next 24 hours with a recording of today's event. So please share it with the members in your community so they can learn about the work being done in Chicago to advance health equity. In the Talmud, there is a blessing called the Shehecheyanu. It is said when one wants to express gratitude. Gratitude may be a difficult sentiment to muster as we reach painful milestones like 700,000 plus lives lost to COVID in the United States and 4.55 million deaths worldwide. But gratitude is essential to the work we are doing now. Gratitude exudes hope, the belief that we have the power to change our circumstances. And today, you heard from several people who I think are truly hopeful. And for that, I express my gratitude that we are here together, that we sustain one another with our efforts, and we all believe we will see better days ahead. Thank you all. Have a great day. Happy birthday, Jordan, and we'll see you next year.